It's The Big Take from Bloomberg News and iHeartRadio. I'm Wes Kosova. Today, how fentanyl caused the opioid crisis to come roaring back. Just before the COVID pandemic hit, there was some cautiously optimistic news about America's decades-old opioid epidemic. After many years of rising deaths from overdoses, the numbers were starting to tick downward in some hard-hit states. And it appeared like prevention and treatment methods were finally starting to work. But that all changed in 2020 when the powerful opioid fentanyl began flooding the streets right as the world shut down. Fentanyl overdoses are now a major health crisis in many places across the country, and public health officials are struggling to keep up.
Well, if you look up the definition of an opioid, the first thing it says is that it creates a feeling of euphoria. After a while, there's no longer that sense of euphoria. It's really just, I want to feel like I can function today.
That's Helena Girouard. She's a health official in Volusia County, Florida, which is one of the places where fentanyl overdoses are a terrible problem. We'll hear more from her in a bit. But first, to explain what's happening and what's being done about it, I'm joined by Bloomberg reporters Emma Court, Leonardo Nicoletti, and Lin, who've worked on a deeply reported story about the fentanyl crisis. Emma, Lin, Leonardo, thanks so much for being here.
Thank you.
Glad to be here.
Thanks for having us.
Let me just start with the most basic question. What is fentanyl?
Fentanyl is a synthetic opioid, and that means it is made in a lab. It's not a natural opioid. And when we're talking about fentanyl, in this context, we're really talking about the rise of illegal fentanyl. Largely, that's what's killing people. But fentanyl was originally sort of developed as a medication to manage pain, and there is a prescription version as well. But in this context, again, really talking more about the illegal drug market.
So that originally this was a manufactured pharmaceutical, but then it became illicitly manufactured.
Yeah, and lately especially, it's really kind of the initial chemicals to make fentanyl are coming from China. They're going to Mexico and manufacturing fentanyl, and it's getting smuggled in through the southern border. And, you know, part of the reason fentanyl is really taken off is because fentanyl is extremely cheap to manufacture, and it's extremely powerful. So it produces a high much more easily than with other kinds of drugs.
So you've gathered in this story an enormous amount of data tracking the rise in the use of fentanyl, and then along with it, the explosive rise in tragic deaths. Could you give us a sense of just how large a problem this is nationwide in the U.S.?
Sure thing. I spent a lot of time analyzing CDC data. That's the data from Centers for Disease Control and Prevention. And just to share one set of numbers, last year, over 80,000 Americans died from opioid overdose, and fentanyl was found in autopsies of at least 70,000 of these deaths. So this includes those people who knowingly or unknowingly took fentanyl. And sometimes there might be drug cocktails that they just took. They didn't know fentanyl was part of it.
A cocktail being they might have taken marijuana and it had fentanyl in it, or heroin, another drug.
Exactly, multiple substances mixed up. And this year's provisional data so far show that almost 90% of Americans who have died of opioid overdose died of fentanyl. That's very gruesome numbers. And as we dove further into our reporting, I was talking to myself. I just think it is an opioid, and this is part of the everlasting opioid crisis. But this exact chapter we are at right now is a real fentanyl crisis. To give you some size and scope, since March 2020, the beginning of the pandemic, more than 165,000 Americans have died from opioid overdoses.
What was it about the pandemic that made people suddenly turn back to opioids and in particular fentanyl?
That's a great question, and it's something we really wanted to explore in this story in particular. I think when you think of the opioid crisis, people often think of prescription drugs, right? They think of Purdue Pharma. You know, there's a long history. The opioid crisis has gone on since the mid to late 1990s in the United States. But in this case, fentanyl was already sort of starting to take off in the U.S. prior to COVID. But what we really saw was in the last 3 years, the deaths from fentanyl just kind of exploded. And we saw like enormous fatalities from fentanyl. And when we tried to sort of explain why that was, the answer we kept kind of coming back to was sort of mostly the ubiquity of fentanyl was a big, big factor. So it's not that people were necessarily seeking it out. It was permeating other illegal drug supplies. So people who were, using drugs like heroin, for instance, or meth, or even something like cocaine or marijuana, which people don't typically think of as these really, some of these drugs don't sound like marijuana particularly dangerous, but they were getting sort of adulterated with fentanyl. Fentanyl was getting kind of mixed into that drug supply.
And why were they mixing fentanyl into those other drugs?
It's a little hard to say. One of the big explanations is that fentanyl is so cheap and so ubiquitous that it was a way of sort of spreading out drug supply. In some cases, it might have also been, an accident, all the stuff being made in the same kind of space. Fentanyl is so poisonous that small mistakes could really be quite devastating. But in addition to sort of the illegal drug supply getting sort of contaminated with fentanyl, another part of that story that's really important is counterfeit pills. So people buying black market adderall or Xanax or other kinds of drugs. And those drugs might not actually be Adderall or Xanax. They might be pills with fentanyl inside, and those might also be causing deadly overdoses. And this seems to be a pretty big trend now, these two sort of factors in the sort of rise of fentanyl.
Yeah, to add on that, a lot of the deaths, they are actually due to accidental overdose when it comes to fentanyl. And from the CDC data, we actually saw like a growing number of deaths when officials were doing autopsies that were multiple narcotics were found in the same body. So many died without knowing from what substance they died from even. And so this cocktail effect has definitely been a new trend that we are observing.
Leonardo Lindley just mentioned the CDC, the Centers for Disease Control and Prevention data. You were heavily involved in gathering and then analyzing the data that you used to track the rise of fentanyl in this story. What did you find in that data?
One of the things that, we found in the data and that we think we showed really clearly in one of the graphics is that a lot of things have been changing in the past few years. And one of the things that has been changing is that who fentanyl has been killing has changed a lot. And, you can see that while the opioid death rate was highest for white Americans for more than 15 years, so until 2016, white Americans were dying at the highest death rate. But now it is highest among Black Americans. You can see that, the opioid death rate for Black Americans has more than doubled since 2017. And most of this increase has happened during the pandemic. Obviously, fentanyl has had a really big role in this increase.
And do we know from the data why there was that switch from more white people dying from overdoses to more Black people dying?
The CDC has actually really tried to highlight this trend over the pandemic. And one of the potential explanations they've given is that access to medical care for opioid use disorder, which is the disease of opioid addiction, may be sort of quite unequal. And so people of color, including Black Americans, also there's been a big increase in the death rate among Native Americans in the U.S., may not have the same kind of access to treatment as white Americans.
One of the things that really struck me in the story, and you had alluded to this before, is just how deadly fentanyl is. And the way you described it was just a few grains of salt worth is enough to overdose. And that so many of the doses of drugs that people buy on the street contained way more than that.
Yeah, so this is something that really struck us as well when we were reporting this story, is that just 2 milligrams of fentanyl equal to a few grains of salt is enough to potentially cause a deadly overdose. And you can envision a few grains of salt. That is a very small amount. And part of the reason for that is that fentanyl is up to 100 times more powerful than morphine, a prescription opioid, and 50 times more powerful than heroin. And so what we actually heard out of the county that we focused on in the story, which is Volusia County, it's in Florida, is that some people were overdosing and they had so much fentanyl in their bodies that it was enough to kill 30 or 40 people. That's what the medical examiner's office told the county council.
My conversation with Emma, Leo, and Lindley continues after the break. So now that we have a pretty good idea of just how powerful and deadly fentanyl is, I want to talk about the focus of your story, which is in Volusia County, Florida, which has seen a huge increase in fentanyl deaths and what's happening there and what they're trying to do about that. Lindley, can you describe what's happened in Volusia County?
So when we were using a database from the CDC that tracks death causes in the U.S., we screened opioid death data of every single county in America and tried to see which ones fit into this exact pattern. And there were scores of counties all over the U.S. that have gone through similar tragedies. And we looked into 50 counties and called 15 of them. After all that work, we picked Volusia in Florida. Then we looked at Volusia's data more closely, and we saw fentanyl-induced overdose deaths tripled in 2020 from the year before. So it was very shocking to us. And it just had a lot to do with the COVID pandemic and all the isolations and everything. And so in Volusia, 272 lives were lost that year due to fentanyl. And more surprisingly, that's over 90% of all of the total opioid overdose deaths in that county that year.
What was it about COVID in particular that would make people turn to drugs? I mean, boredom, I suppose, but that's a pretty extreme solution to boredom.
The way that we have been thinking about and learning about this is really through the lens of losing support and routine and kind of structure of life, right? So all of a sudden, everything has completely changed. And there's also, I mean, it's hard to remember now with so many COVID protocols kind of out the window, but there was a time people were extremely scared of this new virus. And so you put all that together, the fear, the boredom, the loss of support, the social isolation, social distancing was one of the big tactics we used initially to keep this virus at bay. And you have kind of a recipe for people using substances. And there was actually back at that point in time, there was some thought, all this disruption will extend to the drug trade too. But that doesn't seem to have happened. In fact, we've seen, as a result of a lot of these disruptions, we've seen people getting cut off from many vital sources of support for addiction. For instance, in Volusia County, we know some local support groups, some like Narcotics Anonymous style groups, actually stopped meeting for a period of time. Even when they began meeting again, they might have only done so virtually, which, I think we can all recognize that there is a place for Zoom meetings in life, but we were also all getting very tired of Zoom meetings. And then in-person treatment changed a lot too. The clinic that we talk about a lot in this story, SMA Healthcare in Volusia County, was meeting with patients virtually. And one of the providers said to me, virtually, you don't really read people as well. We don't have them in. We can't test their urine for drugs, so we don't really know if they're using drugs again. And we can ask them questions, but we don't totally know, we can't read them, are they telling us the truth or not? So it did really change the dynamic. And even now with things sort of resuming, it's been difficult, I think, to get some of those rhythms back.
Leonardo, when you were looking at all this data and trying to figure out a way to visualize it, what leaped out at you the most from these Florida numbers?
For me, what leaped out the most was really the spike that you see during the pandemic. And it's just so clear. You can look at the graphic and you see that if you just put a ruler on 2020, that's exactly when the spike started.
Like it's almost vertical, that line. It's really crazy to look at.
Exactly like Emma said, it follows the vertical line all the way up to, the highest point of the chart. But I think what really struck me when I was looking at the numbers was just on the national data, the chart was actually too tall to fit on the screen. So there isn't actually a mobile device or a computer that you can use to actually see the entire chart at once. You have to scroll basically through, and as you scroll, you see that you still haven't reached the peak of deaths in 2021.
Emma, so we've outlined this enormous problem, how intractable it is. What works? What do we know actually works to bring down addiction rates and overdoses?
Yeah, so we basically know that one of the most important things you can do when someone has what's known as opioid use disorder, it's, what most people call opioid addiction, is to open up access to medication-assisted treatment. That basically means treating folks with essentially opioids that have been specifically approved by the U.S. Food and Drug Administration, the FDA, to treat, opioid use disorder. And so it's been very well established. This is the gold standard of treating opioid addiction. And these medications essentially help people sort of reduce some of the euphoria highs associated with use of these drugs. But they also help reduce the risk of relapsing. And that's kind of key. It's a controlled environment. These folks are being kind of administered and looked after by medical professionals. And this is supposed to help prevent them from using exactly the kinds of street drugs we're talking about and dying of an overdose. There are a lot of other things, though, that can also be done to address this crisis and are being done, including making naloxone, which is the opioid overdose reversal medication, much more widely available.
And that's Narcan? Is that what we're talking about?
Yeah, the brand name is Narcan. Naloxone's the generic name. And there's been a big push to get this stuff, available over the counter, for instance, so you don't need a prescription anymore to get it, get in the pockets of people, get it out into places like nightclubs where people might be, using drugs and be at risk of overdosing.
And the idea is that it's not the person who's overdosing does it, but somebody who sees someone who's overdosing, they have this on them and they can help that person so the person doesn't die.
Right. And actually, one of the most powerful things I heard while reporting the story was COVID was a disease where social isolation was the way you prevented it from spreading. And you're using drugs alone. There's nobody there to revive you with naloxone, with Narcan, and I thought that was really, that kind of hit me with a punch in the gut. So one thing that a place like Florida is actually starting to do as of this year is they're trying to do a better job connecting people who are at risk of overdose or who are, have overdosed with this medication-assisted treatment. But in Florida and other places around the country, many conservative states are not fully embracing all of the tools of what we call harm reduction. And harm reduction is basically acknowledging that you can't prevent people from using drugs in all instances. But when they do use drugs, you can try to mitigate the harm and make it, safer to use drugs.
Lindley, at the beginning of the interview, you gave us some pretty daunting numbers for a number of people who've died from opioid use, and in particular, fentanyl overdoses. Where are we on the numbers now when it comes to trends?
On the national scale, we are actually seeing, from the total number counts, we are seeing fewer overdose deaths so far this year. But caveat that is we are all just having provisional data for now. They are going to be updated as time goes by. We are gradually walking out of that pandemic, and I'm hopeful that without that as a major contributing factor, we should be able to see fewer drug overdose deaths. And also, there is a growing awareness of what kind of role fentanyl is playing in this overall opioid crisis nowadays. So I'm hoping for the best.
I would also say, in this day and age with fentanyl creeping into so many other illegal drugs that people don't think of as sort of dangerous, these are drugs that are now becoming extremely dangerous, and using them can kill you. It's a very real danger now. It's not a hypothetical situation.
Emma, Lindley, Leo, thanks so much for joining me today.
Thank you.
Thank you so much for having us.
Thanks for having us, Wes.
When we come back, a close-up view of the fentanyl crisis in Florida. For a closer look at fentanyl's toll on people and communities, I'm joined by Helena Girouard, who you heard at the beginning of the episode. She's the Overdose Prevention Coordinator for the Florida Department of Health in Volusia County. Helena, thanks so much for coming on the show.
Thanks so much for having me.
Can you first just describe what does the Overdose Prevention Program Coordinator for Volusia County do? What is your job?
So I get to work with community partners. So this would include hospital systems, the sheriff office, the medical examiner. Most importantly, I get to work with people who've been directly impacted by substance use, whether it's themselves personally or a family member or a friend. And we all work together. We look at the data that's provided by some of those partners, and we find out who is the most impacted, where these overdoses are taking place. And we try really hard to get the messaging out into those areas so that people are aware that what a crisis we're experiencing. We recently now started passing out Narcan at the Department of Health in Volusia County, which is huge. Last week, we had one of our active participants in our work overdosed, and her family requested that Narcan be distributed at her funeral.
So how did you come to this line of work?
I think I started this work just volunteering, being involved in my own recovery. And in 2018 was awarded a fellowship with the Pritzker Children's Initiative. And I focused on substance-exposed newborns. I got some really great experience working in that maternal and child health world, but also with substance use. So that fellowship ended in 2020, and a position was open at the Department of Health in Volusia County, and I think it was created for me. I mean, it feels like it's amazing to come to work every day and get to do things that I'm very passionate about.
For people who use it, how does fentanyl feel that makes it such a powerful drug?
Well, if you look up the definition of an opioid, the first thing it says is that it creates a feeling of euphoria, and that's with a lighter dose. So when somebody uses fentanyl, and this is my own personal experience, that it a feeling of euphoria, and it's scary. It's scary because it's for somebody that experiences anxiety or depression. It could be that moment that you feel normal, like, oh, this is what other people feel like, so I'm going to do it again. And then the intention is never to do it forever, but nobody wakes up every day hoping to fail, and it's progressive and deadly. And after a while, there's no longer that sense of euphoria. It's really just, I want to feel like I can function today.
And how were you able to get off of it?
I was pregnant, and I was able to detox in a hospital under a physician's supervision, nurses around the clock. So it took about 6 days of intense detoxing in the hospital. And then from there, I went to an intensive inpatient facility where I could stay until my daughter was born. And then we stayed until she was almost a year old. So I stayed for a very long time.
And how did your own experience, how does that sort of inform the work you're doing now?
I think I'm able to take my personal experience and remember the feeling so that I'm not doing the work through a lens of judgment. I'm doing it through a lens of compassion and having been there myself and understanding the pain, and that it's not moral failing. It's not because people are bad that they are struggling with substance use. And so it really creates an opportunity for me to have a really open mind with the work. Everybody's recovery is different. Everybody's story is different. And how can we support everybody's recovery in a different way?
Can you describe what the situation is right now in Volusia County?
It's not good. We are second in the state per capita for overdoses. So there are a lot of people dying, a lot of non-fatal overdoses as well. And it's whether they're using fentanyl because they know it, but we also have those who are using something else. I mean, they might think they're taking a Xanax and it's pressed with fentanyl, or they buy some weed and the dealer just had touched fentanyl, and then it gets into the marijuana and they're exposed that way. And, it takes the size of 2 grains of salt to be fatal. So it's pretty serious when, a couple crumbs get into anything else.
You talked about how important Narcan is. Can you describe why it's so important?
Simply, it saves lives. But when Narcan is administered, and it looks like a nasal spray, the one that is most generally in the public. But what they do, it goes in and it goes to the receptors, the opioid receptors in the brain, and it pushes the opioids out. So it pulls the person out of an overdose. It sometimes takes a couple tries, especially with the fentanyl now. I have friends that I personally know that have taken 6 doses to revive them. And another thing that I always like to remind people, if they don't go with the first responders once they arrive, making sure to keep an eye on them, because the Narcan only stays in the receptors for a certain amount of time. So if there's enough opioids in their system, then they could reattach and they can overdose again without even using any more drugs.
And is Narcan something that anyone can carry? And if they see a person is overdosed, they can administer it?
Yes, there's a Good Samaritan Act that covers someone. So what we're taught is if anyone is unresponsive, assume that it's an overdose. If it is not an overdose, it won't hurt them, but it's just something that you want to tell the paramedics when they arrive. Hey, I did administer Narcan just in case, but anybody can do it.
We also often hear about needle exchanges. Is that something that you do, and is that an effective practice?
We don't currently do the needle exchanges in Volusia County, but they have been found to be very, very effective, lowering the risk of endocarditis, hepatitis C, HIV, all of those things can ultimately lead to death. You might not even have to have experience in an overdose. So having access to clean syringes is really, really important.
Are there things that you find are part of the treatment policies that just aren't working very well, that need to be changed?
Well, we talked about syringe exchange. That's a huge one. Fentanyl test strips. The test strips are not legal in the state of Florida. They're considered paraphernalia. There are groups that they go to dance parties or different venues like that, concerts, and they will provide the strips there. So if you are using something and you want to test it to make sure it doesn't have fentanyl in it, they can do it without you getting in trouble. I think that should be everywhere. I think that, that's something that should be easily accessible, just like Narcan is now.
Are you starting to see results from your work? Can you see that you're making a dent in overdose numbers?
I would like to hope that. I know that our community partners since the beginning of the year have been tracking the amount of Narcan that they're distributing, and they also track how many reversals are reported.
What is a reversal?
So a reversal would be if someone had to use their Narcan and they revived someone and they come back and say, I need some more because I had to use it. So they're reporting that they were able to save a life with that Narcan. But at the beginning, there wasn't that trust. So no one was reporting. And now people are reporting, and we have had with just one of our community partners, over 100 reversals reported.
And have you found the public is more receptive now to taking and carrying Narcan in the event that they come across someone who's overdosed?
I think we have work to do, but I think so. I think if you're able to have that real conversation, people are becoming more open to it.
Helena Girouard, thanks so much for taking the time to talk to me today.
Thank you.
You can read the fentanyl story by Emma Court, Leonardo Nicoletti, Lin, and Madeline Campbell at Bloomberg.com. Thanks for listening to us here at The Big Take. It's a daily podcast from Bloomberg and iHeartRadio. For more shows from iHeartRadio, visit the iHeartRadio app, Apple Podcasts, or wherever you listen. Read today's story and subscribe to our daily newsletter at Bloomberg.com/bigtake. And we'd love to hear from you. Email us with questions or comments to bigtake@bloomberg.net. The supervising producer of The Big Take is Vicky Vergolina. Our senior producer is Catherine Fink. Our producer is Rebecca Chasson. Our associate producer is Sam Gabauer. Raphael Amsili is our engineer. Original music by Leo Sidran. I'm Wes Kosova. We'll be back tomorrow with another Big Take.